Good afternoon, all of you. Today we are going to hear from Dr. Suresh Patankar sir. I would like to introduce him. He is founder trustee of AMAI Charitable Trust. He is ex-professor and head of Department of Urology, BJ Government Medical College, Sasun General Hospital, Pune. He is professor and chairman, Department of Urology, Ace Hospital and Research Center, and consultant urologist. He is founder trustee of Urology Society of Pune. He is program coordinator and mentor for a fellowship course in minimal access surgery, FMAS, urology by MHS Nashik. He was member of BOS DY Patil Pune, governor's nominee to Management Council of MHS Nashik during the last 5 years. Expert invitee, national vice president and active member of Arogya Bharati. He is member of Working Group 3, Integrative Approach to Health, Niti Aayog Initiative. He is expert member committee for establishment of postgraduate education and research institute, MHS Nashik, India. He is visiting Eurotransplant surgeon, BJ Government Medical College, Sasun General Hospital, Pune. Apart from that, sir is emeritus professor of Maharashtra University of Health Sciences. So I will now request Dr. Patankar sir to start his lecture today.
Can I start?
Yes, sir, please.
सुरुवातीला आपण धन्वंतरी स्तवन करून जो आपला सर्व औषध शास्त्राचा देव आहे त्याचं स्तवन करून उद्या धन्वंतरी जयंती पण आहे आणि मग आपण लेक्चरला सुरुवात करूया. तर मी एक 30 सेकंदात मंत्र म्हणतो आणि देन विल गो फॉर द फर्दर. नमामि धन्वंतरि आदिदेवं सुरासुरैवन्दितपादपद्मं लोकैर्जरारुक् भयमृत्युनाशं दातारमीशं विविध औषधीनां नत्वहं कामये राज्यं न स्वर्गं न पुनर्भवं कामये दुःखतप्तानां प्राणिनां आर्तिनाशनम्. I'm thankful for the kind words said by Professor Palaskar sir. Outside, I would like to express my gratitude towards Vice Chancellor Lieutenant General Madhuri Kanitkar, Pro Vice Chancellor Dr. Professor Nekumba sir, Dr. Palaskar sir again, the Mrunal Patil madam, who is the Dean of the Academics, my junior colleague, I would say, Dr. Avade, who is there since I joined MUHS, other staff members and other staff of the MUHS. I'll be talking about the new dimensions of research in our medicine. Just to give a brief overview of what was there in Indian perspective. If you look at the Kailash temple, built one of the world's, you can say, astonishing structure built by Indians. And this is the other side of my right hand side, you can see the great population, how we are progressing, and we have become the world's largest populous country in the world. Einstein once remarks, what remains after education is one has forgotten everything he learned in the school. In short, what he says, once you are in practice, don't try to remember textbooks, because if you merely follow the textbooks, who will do the innovation and who do the invention? So this is very important, especially this may not be for all the people, but people who are having a research mind. I always call it as a thinking out of the box. Then they will be able to give justice to the research concept. I'm just sharing my journey to give. This is not a very great thing. I just do not want to say something great. I've done it, but just even a perspective how one can do the unexplored ancient sciences to the modern sciences. It doesn't mean we should not integrate modern sciences as well. In fact, integration means integration with your own specialty, your own path of work with other specialty, other sciences. So it may be ancient sciences or modern sciences. This was Shushru, the father of Indian surgery. You can see what great inventions he has done. Apart from the surgical techniques, the instruments which he has researched still have some meaning after 5,000 years. This was the situation then. And now, unfortunately, I must submit and admit that research in medicine is very sparse, not up to the mark, and that is one of the reasons probably the dynamic prime minister has make an tagline, make in India. Now I start with my proper topic that whenever you want to do any research, the research question must be very clear in your mind. If you are confused what exactly I am going to do it, I think you will end up into confusion only. So once you know your research questions, all details, you give sufficient time thinking and lot of brainstorming, and then you can start your journey on that path. I'm just coming to my own experience. There are many, being an practitioner in allopathy, where we do lot of modern surgeries like transplants, robotic, laparoscopy, laser, and all that. But in spite of that, what I realized, there are some scenarios where there is no treatment or no satisfactory treatment in modern medicine, and then one has to look towards the other systems of medicines because the medicine should be patient centric, not the pathy centric. So that is what the patient expect from us. And for this, the integrative approach is needed in today's medical practice. Yeah, I agree. There are a lot of lacunas in research in traditional medicines because it's a laborious, time consuming. It has a lot of phytochemicals. There are a lot of variations, no pharmacopoeias, lack of regulatory controls, safety, efficacy are not available, which is the mainstay of research in modern medicine. There are no, you can say, proper clinical trials, difficult to develop GAP, good agile practices, GMP, quality control, and good clinical practices. We do agree, but still, one has to overcome these difficulties and move forward. What needed, and especially we're talking about herbal medicine, is one has to have a scientific base of today's modern medicine, what is known as the NCE, a new chemical entity. Obviously, it means it cannot apply ditto, but with some modifications to your research. The approach is what is known as reverse pharmacology. Don't go in many details. It is bench to bedside. So what is proven, you prove it by scientific way. Now we will take a couple of instances of various research topics which I had done my studies. The first topic is, urolithiasis. For a urologist, the other synonym in Marathi is patharvat, the one who breaks the stones. One on the right hand side, you can see a big 196-gram stones removed by one of the largest stones removed by me by laparoscopic technique. But a worldwide phenomenon for early small stones, asymptomatic stones, residual stones after procedures, recurrent stones, there is no satisfactory answer in modern medicine. So this is a question came to my mind after seeing treating thousands of patients. What can be done for an early stage of the disease to prevent these future complications or future big stones? I have gone through the various pharmacological studies and found that Varun is one of the main herb which has been used in various urological conditions in general and Muthkhada or stone condition is in particular. There are a lot of pharmacological studies. What is the active constituent like in Varun case of luteol? It has got anti-oxaluric acid, anti-calciuric, that means it reduces the oxalates and calcium in the urine. So then we took this and we did the standardization. This is most important. Especially it is very important for the Ayurvedic practitioners to standardize your formulation. It has to be from a proper authentication, manufacturing, safety evaluation as per the FDA norms. This is how we done the authentication by Agarkar Institute in Pune. This is the toxicity study, that means doesn't have any heavy metals, which is the one of the objections. Unfortunately, this is one of the objections taken on the herbal medicine, that it contains lead, mercury, and that gives lot of side effects. So one must ensure that your preparation is out, not having any untoward elements. We develop with the HPTLC methods just to standardize. Then, so once we done the lab studies, we have gone for the animal models of urolithiasis. We created an animal model of rat in whom we created the small stones. First, we did the what is known as acute and subacute studies by certain guidelines to confirm that this is a safe formulation. Then we did the efficacy studies, and then in efficacy studies, we found out there are a lot of significant positive changes as an prevention or dissolution of small stones. We can see the urine of a rat. This is urine of a rat. You can see the Hermet Plus is our IP, our investigative product. These are the cystone is a commonly known product available. Alkastone is a proprietary modern medicine. If you see, the number of crystals are least in case of Hermet Plus. Then we did some studies on oxalate synthesis in enzymes. Oxalate is a most important constituent for one of the stone formations. We did various enzyme studies like ALP, alkaline phosphatase, gamma glutamate transferase, lactate dehydrogenase, and many. Again, we found that the levels of these enzymes are significantly reduced by decreasing. It means a decrease in urolithiasis. This is a table. I don't want to go. This is another very important part. This is histopathology of the rat kidney where stones were produced. And what is as shown, if you look at the normal control, disease control, Hermet and cystone, the damage produced by a stone formation in rats of the kidney is minimum. That means this particular formulation has got a rejuvenative or repairing function or repairing activity in rat kidneys, which is a very unusual, very surprising finding to all of us. This is the score protective effect, which I just mentioned some time back. Then obviously, once you do animal studies, one has to do for a proper scientific randomized double-blind placebo-controlled trial, which was again registered with CTRI and government in inclusion exclusion criteria. You all know clinical assessment. These are the bars. We did not go. What we have seen, the expulsion of renal calculi was greatest in treatment group. One can see this blue, and the blue in the treatment group, obviously more. Reduction in the size was another positive finding. A reduction in the size of the stone was seen in the treatment group. Pain factor was also significantly less. So then we also did the study in recurrent stone formation, which is a very common problem in stone patients: hypercalciuria, hyperoxaluria, hypocyturia. They were all get corrected with this formulation. Obviously, this is another thing which I wanted to share. Whenever you do something different, out of the way, it is your IPR. It is what is known as intellectual property right. So we have got Indian patent, we got international patent, USA and Europe patents for this. Because when you have done so much of work, it should be the credit must be go to the inventor. This is Indian patent, this is US patent, this is European patent. Then all this work must be appreciated by your peers. We can see this was presented in American Urological Association, the world's most scientific organization, and there it was mentioned in the highlights of the conference. So even Americans have accepted it because we generated so much of data, the scientific data to prove our point. These are a few of this thing. I think then we had publications in index journals. This is how one has to, the research should go. Second part, the research question. Being a surgeon, we cut and we stitch. But the problem is improper wound healing leading to fibrosis is a major reason for failure in spite of good surgical technique. A good surgeon does a good surgery, but still it fails because of the fibrosis. Stitcher is one of the common diseases of fibrosis. A lot of work is being done in abroad to whether one can reduce the scar formation. We did not go to the city, connectivity growth, but these are all details. But point here is fibrosis, which creates a lots and lots of problems. This is the study done by in modern medicine. They use mitomycin, botulinum toxin, glucocorticoids, apamycin, haloperidol. This is a Chinese herb, but still there is no satisfactory answer. So then we look what we can do in alternative treatment, because in Ayurveda there are some mentions that there is a Varana Shodhan, Varana Lekhan, Varana Ropan principles. On that principle, on a reverse formulary approach, we make an own formulation again after doing a pilot study, and again we same standard we have done, which I showed you some time back for the stones. Preclinical studies, especially here in wound contraction, wound breaking, antioxidant status, connective tissue formation. These are the various factors what we have checked by doing the safety studies followed by efficacy studies. This is the dermatoxicities of one can female male rat. This is the subacute dermatoxicity. This is a histopathology. Once you create the wound, you take out some tissue and put it under microscope to see the scab formation, reepithelialization, fibroblasts, various mononuclear cells, phagocytosis, neovascularization, various factors. One has to check whether your formulation has really helped in regeneration of wound compared to other resisting. So what we have seen, preclinical studies, a favorable wound healing by various stages of wound formation and turnover of the collagen, which is a very important part in any scar formation. So this is we have seen in the preclinical. So once we are got convinced, we further move to the clinical stages of what is known as open wounds using buccal mucosa. You can see this when we remove the skin. This skin is used in our stricture patients as a supplementary. You can say to supplement the stricture this thing graft. So then we also use in internal wounds. We are using it following prostate operations, various including transplants. It's a surprise. Whenever you do transplant, we use this because we are convinced. Because we have done all the studies. First, we did all the studies. We are confirmed it is a totally safe. It can be autoclave. So infection, there is no question of infection. Then again, same thing, publications in good journals, important. Then we got the patent, Indian, US, European patent. Now coming to third, probably you might say, Dr. Patankar, you're a urologist, but my interests are diverse. When you do research, we should not restrict yourself to one aspect of the things. So probably I had a lot of studies in immunology, and I felt COVID is a viral disease, and only the immunity, active or passive immunity, is a major way by which you can prevent. What is vaccine? Vaccine is a passive immunity. So if you improve the immunity of the patients by, because there are certain herbs mentioned in Ayurvedic literature, and we have done some studies, clinical studies in our own hospital to see the improvement in the immunity, and we did a formulation in COVID times. Of course, this in all this thing, we also had proper physicians. It's not that me doing all these studies. I may be the principal investigator, but whenever we are doing any studies, we have got the specialist. This is very important. Integration means again integration not with the science, integration with the people who practice. One should not forget. One should not see only Ayurveda. I think Ayurvedic physicians or whatever specialist. Now here we took the physicians, chest physicians in our study. You will surprise, the protocol of the trial was published in one of the most BMC, one of the most prestigious journal. It was such a robust protocol. We made it that time. Of course, now there is no more COVID. It was published in that journal. The efficacy, safety of hormonal polyhormonal formulation as an add-on. Whenever we are doing study for any disease, we never drop the standard care, because that is the standard of care is known. So one should not stop it. So you should give as an add-on treatment. Then only you can. So once you confirm, then you may try without that. But at least initial part, you must command with the initial this thing. You surprise the parameters. You can imagine what parameters were made apart from the viral load. B cell count, T cell count, CD4, T helper cell, CD3, CD8. These all we measured. NK cell, the most natural killer cell. This is the most important cell to fight any disease in the body. It's from, you can say, cold to cancer, or in fact aging. Aging is also related to the NK cells, that is natural killer cells. So all these studies we have done it, the TH cell response, and what we have seen, IgG antibodies we are also measured. And everywhere we find the patients who were treated with our immunomodulatory. It's a immunomodulatory. It cannot be a specific antibody. It's a generalized immunomodulatory formulation. And what we have seen with improvement of immunity, the patient's recovery and all parameters were improved. So you can say it is a safe, no serious, and it can be safely given along with the standard care. Again, we applied for the patent. We also use as a post-vaccination patients. And since time is short, again, we did a lot of studies, IgG, CD3, CD4, CD8, and cell count in post-vaccination patients. And surprisingly, let me tell you, what we have seen that if you give this formulation to a population who has been immunized, the immunity period is getting prolonged. So one may call it as a herbal vaccine. Again, I wouldn't say yes, vaccine has to be taken, but if you want to prolong the booster dose, this can be helpful. Another, fatty liver. The question is fatty liver. If you see many of us, in fact, I'm sure the people who are watching, if they do their sonography, they will say they have seen the fatty liver, a very common phenomenon. It is known as non-alcoholic fatty liver disease, a very common disease, and you can see the incidence. It is increasing. And why I got this into this, because when I started seeing stone patients, almost 80% of the patients in sonography, they mention about the stone, and they mention about the fatty liver, grade 1, grade 2, and all that. Then I realized what is the importance of fatty liver, because fatty liver is a part of a metabolic syndrome. Now, the today's concept of any disease or most of the disease is a part of a metabolic syndrome. And in metabolism, liver plays a great role. So that is how I got into this. Again, we start looking in medicine in modern. I talked to my colleagues in gastroenterology. They said there is no specific medicine. In fact, they say we prescribe Live 52. I don't know how much study has been done. And then we did a study, a randomized double-blind parallel group trial, efficacy, safety of polyol formulation in non-alcoholic fatty liver disease. This was done outside in 2 centers in India. Again, with me, there were colleagues from the gastroenterology department, the properly DM gastroenterologists were working with me, because I do not want any conflict of interest in my research. And statistical improvement in the oxidative enzymes, lipid parameters, insulin resistance. These are the biochemical parameters. It was improvement seen in the ultrasound and MRI. We did MRI also. So I can say this can be recommended for treating non-alcoholic fatty liver disease along with the standard care. Next is, as you know, as a urologist, we survive on stone and prostates, a troublesome old age companion. Many medicines are available, but probably many of them may not have so much of efficacy. Again, the same, we did a prospective multicentral randomized open label 2-arm studies along with a preparation, which with my own experience along with the SOC, and we conducted the trial, and we found that if you give this preparation along with the standard care, the results are much better. Again, this was done by different urologists, not by me at our center, to avoid the conflict of interest. And again, we are very happy that probably we start prescribing this medicine along with the medical management of today's modern medicine for enlarged prostate. The next research question is most important. Gut health. Gut health is again has come to a big way. Nowadays, we say what you are is what your flora is. It could be a gut flora, it could be the flora of the respiratory system, it could be, since Dr. Polaskar is there, he also knows the importance of oral flora. So flora plays a major role. And most of that flora is gut health. And to have CKD is chronic kidney disease. a very treacherous, a very, you can say, a disease which really kills the patient and patient's family. It is worse than a cancer, or you can say worse than any cardiac problem, because here the patient keeps on living for a long time, being on dialysis, spending money, and ultimately result is sometime or other death, or you go for the transplant. So probably gut health is very important. There are lots and lots of articles nowadays in regarding the gut health. In fact, the new regimen of practice is role of probiotics. A lot of, because they say if you go probiotics, it improves the flora, gut flora. Then I thought, why not look other way around? Because in Ayurveda, they say Basti is a Ardha Chikitsa. That means it is a half treatment. So we again thought over this. We did some initial pilot studies, and then we did a prospective randomized study to evaluate the safety and efficacy of this Ayurvedic regimen, especially Basti and some other immunomodulator medicines. And what we see, if you see the percentage, again, what are the endpoints? The change in the TNF alpha, IL-6, IL-18, and endotoxins between the groups, the most modern parameters to see the improvement as an anti-inflammatory activity. The next most important is percentage change in the pathogenic microbiome, because once you are in CKD or for any disease, IBS, you can take it, your gut flora changes and the pathogenic microbiomes, they become more compared to the non-pathogenic. So there was a percentage change, significant percentage change in the pathogenic bacteria. And there was increase in the non-pathogenic bacteria in the group who were treated with our intervention. Intervention means oral as well as the rectal medication. So this is what we have seen. This is CKD, type 2 diabetes. We have taken selected a specific area and we did this study, because again, I would say, being a urologist, I thought since there is no solution for this problem, let us do this study and we come out with this preparation. Again, further improvement in changes in uremic metabolites like uric acid, creatinine, etc. Then you can say the gastric health also improved. But this was my research, or you can say my romance with the traditional medicines. I also did research in modern technologies. Now, 3D vision is a very new innovative concept in our minimally invasive surgery. Urology we use most laparoscopic surgery, 3D, because 3D is, it means real time you can surgery like open surgery. So 3D laparoscopy you are using it, but then I see there are lots of unsolved problems. So how to solve them? So again, we thought over this. There are a couple of things just to share with you. One of the thing is the limited field of vision. Secondly, clashing of instruments. Many times the telescope get fogged. Many times the blood comes and then you can't see it. You have to take out the endoscopes. So these are many problems what we have seen in our present 3D system. So we come out with innovation where the field of vision will be more, the flexible tip, like a frog. You know, frog, if you know the frog, frog doesn't have neck, and without moving the neck, he can see on all the sides. So similar type of principle we incorporate in our laparoscope. So once you put at one place, you can see almost 270-degree field of vision. Normally we get 180 degrees, because make a camera like our neck cannot move more than that. But if you know the frog doesn't have neck, but he has got eyes, eyeballs, which keeps on moving forward, backward, upwards, downwards. And that is the concept we incorporate into this. Apart from that, some other changes we made it. So the common problems of fogging, bleeding, we completely eliminated in this. I won't go into details because this is time is limited. So in short, we come out with a new vision system, which is simpler, economical, and impeccable, which has addressed all the issues. We have made the PCT. PCT, patent cooperative treaty, as a novel innovative idea. The next thing is, my research question was, can we make surgery simple with multifunction instrument? I tell you, when we do surgery, important thing is, one is the cut, second is the hold, there is a stitch. Now, for everything, you have to change the instrument. That means you require a scissor, you require a needle holder, you require a dissector. So every time you change the instrument, there is a break in the continuity of the surgery. So this is more important in case of laparoscopy because you are concentrating on a very small area. If you have to change the instrument, there is a break in continuity of the surgery. So we thought probably as an instrument, why not we devise an instrument where it can perform more than two or three functions at one time. That means it can cut, it can shear, it can dissect, and it can stitch. But this is another multifunctional instrument. This is what we have done it. This is a prototype we have made it. These are the engineering details. I won't go much into it. So at the end, before I again stop, this is a lot of things we have done it. Now, very recently, recent research question, how it comes to my mind. A transurethral resection of prostate is one of the commonest procedure done in the urological field. But one of the problem or one of the side effect or one can say a complication is a stricture, that is a narrowing. So why it happens? Well, there are lot and lots of literature has been there. They say the instrument size is there, the large instrument size is there, then the current leakage is there. There's so many things are there in this particular procedure, but nobody could point out whether you can predict a stricture formation. So again, we started doing procedures. Then at the end of it, we started saying, let's see what happens at the end of the procedure. Because when you are completing the procedure, you are in a hurry to close it. Come out. Because you have done the procedure, you already done so much. We don't want to spend more time. So what we started doing after completing the procedure, we again started doing the exit examination. And what we found out, very surprisingly, the patients who had developed a mucosal rupture and we graded it. Rupture means there is an injury. Obviously, any instrument you put it in the passage, it is going to produce some kind of a macroscopic or a very superficial injuries. But especially those patients who had developed grade 3 rupture, that means almost the whole mucus has been torn, they develop the stitch. So in this particular research article, what we are seeing is that if you are completing the procedure, do an exit examination, and if you see a grade 3, then you can definitely take some care. Whether you can prevent it 100%, I do not know, but at least you know this is a patient likely to develop complications. So you take care, see that if it is diabetes, control the diabetes. If it is an infection, control the infection. You can use some other medicines to improve the wound healing, and so that the incidence of stricture will be less. So, my dear friends, this is what I have done in my whole surgical practice. Still, we are working on this. I just want to share with my small experience in medical field. Research question means what you are doing is a never ideal thing, is a never complete thing. Think what is not there, and that is your research question, and then you start working on it. And I'm sure, see, these inventors, they are mad people. That mad people means what they say. I always tell my juniors, textbooks were guidelines. You practice for sufficient time. Forget about textbook. What you see is more important because textbook is written by one person, two person, three persons. What is their experience? But if you are seeing enough number of patients, you have your own textbook or practical textbook to guide you and to tell you, no, these are the problems and how do I come out of this? And this is how research should be done, should be thought over. And the topic which I started with integration. Integration is think your specialty, your science is never complete. There are so many things are developing outside our own science. Now let's see in case of urology, laparoscopy, which was not there, robotic was not there, lasers. We have got a very latest laser, thulium fiber laser. The 40 years in my practice, I said, no, not a such a beautiful instrument. We started experimenting with it. So think what is new, assess it, and how you incorporate in your own practice. Talk to your colleagues outside your specialty, and probably you will find a lot of integration that can be done. So coming to an end, I'm really thankful to again MUHS for this wonderful opportunity. My respected Madam, Lieutenant Kanitkar, Vice Chancellor Nikumba sir, URD department, Professor Palaskar sir, Professor Meena Patil, Pramod Avale, others I am not been able to make out, I mean not been known. I can see the name of Dr. Andura Chogale madam. So my thanks to all of you. Now, at the end I will say Om Sahana Bhavatu, may all be protected. Dhanyavad.
I request the faculties of university departments that are present here, if any questions they can ask to sir.
Yeah. Dr. Anuradha here. Can I?
Yes,
Should
yes,
I
ma'am.
put it in a chat or can I ask a question?
Please ask.
Okay. Thanks for the wonderful talk, sir, Dr. Patankar. I've been in the research for last 35 years plus, and I have nearly 140 plus publications. So my question to you is, I'm a cancer researcher. So what should be our approach? Whether we should have the focus proof of concept and then we should work accordingly, or whether along with the side of the proof of concept, we get to know so many research questions and all, and should we start working on it? Because many a times it so happens your concept is different, and as per your results you start getting deviated and you get something new findings. So how you
Hello.
incorporate? Yeah. Yes, sir. Hello.
Madam, please continue.
Yes, so that was my question first. And second question, do you always focus which journal you should like, whether it's a good impact factor
Hello.
or of your interest we should put in the paper for publication? Yes, I finished my two questions.
Hello.
Yes. I think sir is not able to.
Sir, you got it, sir, question?
Hello.
हाँ sir, हाँ sir.
Hello.
Sir, hello, आवाज येतोय sir?
We can hear you, sir. You are audible.
Unmute कर दो.
हाँ ना वो पहले से ही चालू था वो
Hello.
Sir, आवाज येतोय आपल्याला? Sir.
आवळे सर अनम्यूट करा
हाँ
ना.
सर, आवाज येतोय का?
आवाज ऐकायला येत नाही, ऑडिओ ऐकायला येत नाहीये.
येत नाही का? ओके. तुमचा आवाज कमी झालाय का बघा सर तुमचा.
हॅलो.
व्हॉल्यूम कमी झालाय तुमचा.
आता ऐकायला येत आहे?
हा, तुमचा येतोय. आमचा येतोय का?
आता आला, आता यायला लागलाय.
अनुराधा मॅडम, इन शॉर्ट प्लीज रिपीट.
Yeah. So I'm in the cancer research for last 35 years, and I have nearly 140 plus publications.
Great.
My question is whether you prepare first a proof of concept, but many a times what happens as you are working along with it, many questions you get to know, like, yes, how should I work for this? And your research, new research comes up and you start working on that. It gets deviated. So how do you work on this, sir? Like, and second thing is whether you always work for a good journal of publication in the highest impact factor, or you start from the lowest impact factor to a highest impact factor.
I generally,
Come down.
yeah, good question, madam. I answer the last part first. Regarding my publication, the first thing, it has to be a PubMed index journal. Second,
Yes.
you go for, see, I know today's problem is there's so much of APC, particle processing charges for open access. So it is beyond the individual's thing. So I go for a middle order impact factors. In our thing is maximum impact factor in our journals in urology or thing is around 5 to 6 or 7. So journal which
Okay.
is having 2 to 5, I opt for that. But see to it, it will be published in an index PubMed journal.
Yes. Yeah,
Yeah.
that is there. And first question was about the proof of concept, because when you have a research in your mind, first you establish is the proof of concept, and when you actually start working on it, you find some interesting results and your actual proof of concept gets deviated. So what should be done? Whether we should start working on the deviated question first, or we should go back and work on our proof of concept?
Initially, sorry. initially, whenever I started doing my research, I always accepted the standard care. What is standard, you have to do it. So whether it can increase the efficacy or enhance the results of your present therapy. Like I can give example of this thing. Another research topic in my mind is role of pimply.
Mm, mm,
Pimply, whether it can be used along with the antibiotics to enhance the duration, or sometimes you can get resistance. Just give an example. So
mm,
it has to be explored. The question is in my mind. Now we get so much of antibiotic resistance.
mm,
So whether Ayurvedic formulation of some kind to be
mm,
combined along with the antibiotics, and then
mhm,
to see whether it will prolong the metabolism, reduce the incidence of resistance. Regarding
mm,
cancer, what I just wanted to share with you,
mm,
I, I had a talk with a few of the cancer specialists.
mm,
Uh, I said, you give so much of chemotherapy, then so much of, okay, it's a good thing, it required. But would you
mm,
not like to reduce the your side effects either by reducing the dosages or
mm.
improving the immunity? One of the things which I see in the natural killer cells, of course, I'm a very, you can say, a primary student in immunology. You are much more than this.
Yes,
NK
yes,
cells is a very important part in our body, natural killer.
mm,
So if you can see by initial experimentation, by giving this particular formulation, if you can
mm.
enhance the NK cells, other immunomodulator factors, then one
Yeah,
add into your research project. So some pilot thinking has to be done before we
yeah,
jump into a proper hardcore research.
perfect, sir. A
Right,
lot
ma'am?
of work is going on NK cells and PDL1 as
Yes,
an IO therapy in cancer. So,
yes.
yeah.
So certainly now the one formulation which I talked about COVID was never
Mm,
meant for COVID. And
yeah.
for my patients, I said ki we give anabolic steroids, we give
Mm,
vitamins, we give this, that. Why not? There must be something even in the Ayurveda. So
correct.
Google, there may a lot of things we have seen this, and then we got it, and then in this COVID we did this NK cell studies, TH1, TH, all those studies. What we seen, see, this is a basic platform. Body is a basic platform. Then you can get vertical offshoots. In allopathy, we look at a very micro, and in Ayurveda, it is a macro concept.
Correct.
So you can combine micro and macro concept in our research.
Okay. Got it, sir. I'm also working in Tata on the natural killer cells on
Yeah.
NK cells. Yeah.
Yes. But madam, the problem in what I realize, that problem to do on modern medicine is out of our capacity, in the sense the infrastructure, the investments, all those
Mhm.
things are very difficult to get it. And
Yes,
why not we do a very simpler economical way and see whether it can work?
absolutely.
Certainly, I mean, these NK cells, I might share, this is in my mind also, patients who are on cancer therapy, we can measure their NK cells, two groups, give some intervention, just do a small basic study and see the result.
Absolutely.
That can also be done.
Yes, sir.
Right, madam?
Thank you so much, sir.
Good.
Nice.
Yes.
Thank you, madam, for your interactive session. If anybody is interested to ask question to sir. So now we are going to end this lecture. I'm very much thankful to Dr. Suresh Patankar sir. Uh, the word Patankar, the other people are being used as a patent in Ayurveda fraternity. We used to sir as a most patents in Ayurveda faculty. So we are very fortunate today that sir has given his in-depth knowledge and his own experience for the entire community of medical sciences. Sir has excellently described how we can use reverse pharmacology approach in this era, because there are too much of limitations for conventional pharmacology. And for Ayush system of medicine, reverse pharmacology is the suitable methodology to conduct the research in future. Thank you very much for highlighting the reverse pharmacology. The non-alcoholic fatty liver diseases and gut health. So these are two emerging diseases in community, and it is exact need of community, and you are just taking the right path, sir. Uh, we are very much thankful for giving us today lecture, but in past also by formulating our research policy, and we are very thankful in future also. We will work together and under your guidance for conducting various research projects as emeritus professor. With these words, I thanks to you, sir. And now I want to some vote of thanks to all our dignitaries and our authorities. I start with our Vice Chancellor, Madam Dr. Lieutenant General Madhuri Kanti, Madam, then Dr. Milind Dikum, sir, our Pro Vice Chancellor, sir, Dr. Rajesh Bangal, sir is listening this session from starts. Sir is joined for session and is listening entire deliberation by Dr. Patakar, sir. Thank you very much, sir, for spending your valuable time. I must thank to Dr. Pranal Patil, madam. Under her dynamic leadership, the new activities are being conducted and successfully we are, as academic week, we are developing very nicely. I'm very thankful to Dr. Jayant Palaskar, sir, our head of department URD, my colleague, Dr. Vaishali Gambire, assistant professor. I will also like to give thanks to my all entire team of regional centers, including Anuradha Chogle madam, Dr. Singh, Harshal Morris sir, all the faculties are being attending this session. And not at last, I will thanks to my technical team, Mr. Sachin Dende and Diptesh for organizing technical session and making this session making online available on YouTube. In future also, uh, anybody who will miss this session, they can attend and see the session in YouTube also. So with these words, with the permission of the madam, I will announce that this lecture has been ended. Thank you very much, sir.